It simultaneously feels like forever ago and yesterday.
5 years ago, a lockdown order was issued. Businesses closed, people stayed home. Hospitals filled up with people coming in sick from COVID-19. Bob Belknap with the Public Health Institute at Denver Health says those first few days, first few weeks felt strange.
How slow things felt at times and how quickly things were moving.
Belknap says it took more than a year to shift from pandemic levels of people filling ICUs and dying with stunning frequency to shift toward endemic levels, where immunizations and infections would make coronavirus more mild, a part of the respiratory season.
And then can kind of continue into and blend with the usual respiratory season that we see with influenza and RSV.
And for years, COVID would change the way we got sick, even in expected illnesses like RSV and flu.
Well, I think all of them did during the pandemic, and when we really were practicing social distancing and masking. We saw declines in really everything.
As people put their masks down and crowded near one another again, viruses made a comeback, concerning especially for young kids with little to no immunity.
And so then when we're re-exposed, we can see a surge in multiple things at the same time, and sometimes more severe. And so, we had the triple demic that was talked about in sort of 2022.
In the 5 years since, many respiratory illnesses appeared out of season, even COVID, as it searched for its own season to spread. But not every illness is so easily tracked.
One that is a little harder to understand what the pandemic's impact on it was tuberculosis.
Tuberculosis is airborne. It can take years to show up. Belknap says as resources shifted to fight coronavirus, diagnoses were delayed or missed entirely. Cases did drop as COVID-19 climbed, a trend that's now turning around.
And the full impact will take years or decades to fully see because of the nature of that infection.
5 years after COVID-19's spread started, Belknap says they're still learning how large an impact it's had on healthcare as a whole. But whether the lessons they learned in 2020 will last.
Some of the lessons learned, whether and how effective we will be at applying them, is hard to know.
Even 5 years out from COVID-19 first starting to spread, public health officials say they're still keeping a close eye in case a new variant pops up that's far more severe. They say whether it's coronavirus or something like bird flu or measles, there's always something new waiting in the wings for its chance to spread. And that's why they're always vigilant about trying to stop the spread before it starts.
I was just thinking the other week, because I had a daughter during the pandemic, and she never got sick as a young kid. And now I have a 1-year-old. She's sick constantly. And I was like, oh, wait, social distancing, masking, all these things we learned. It feels like we've kind of gotten away from, but they really did make us safer.
Absolutely. And, we see with those young kids who didn't have that immunity and why we saw such a severe RSV season and why we saw such a severe flu season. It was something that was really scary and for a lot of kids and a lot of adults, fatal.
There's that big time span that we're still going to be studying for decades.
Absolutely.
See how things have changed. Thanks, Rachel.